Hello and welcome to Lyra Nara. In this video we're going to talk about chronic obstructive pulmonary diseases. We're gonna discuss the symptoms, the causes, the tests that you have to perform in order to establish that you have some type of chronic obstructive pulmonary disease, and of course talk about natural supplements and remedies that really work. So without further ado, let's dive right into it and learn more about COPD. First, we're going to establish what we're talking about. So what are COPDs, or chronic obstructive pulmonary diseases? Well, COPD is an umbrella term used to describe progressive lung diseases including emphysema, chronic bronchitis, and refractory non-reversible asthma. This disease is characterized by increasing breathlessness, and COPD is a progressive and currently incurable disease. But as you will gonna see, with the right treatment, there are many things you can do to manage your COPD and stop it advancing. Then let's discuss also what is an emphysema. Well, an emphysema is damage to the alveoli, so the air sacs in your lungs, and the walls inside the alveoli collapse, converting many small sacs into larger single sacs. These larger sacs do not properly absorb oxygen, and thus less oxygen is absorbed also into the blood. Also, when the alveoli are damaged, the lungs become stretched out and lose their springiness or sponginess. The airways become flabby and air is trapped in the lungs. Therefore, it gets hard to breathe out, and this creates a feeling of shortness of breath. Then we have chronic bronchitis. The chronic bronchitis is a damage to the bronchial mucosa that causes chronic bronchitis. This causes coughing and shortness of breath. And if mucus yields the cough and the cough lasts at least 3 months for 2 years in a row, the bronchitis has become what is called a chronic bronchitis. There are hair-like fibers that line the bronchial tubes of the lungs, and these tiny hairs are called cilia. And the cilia help move mucus up the tube so it can be coughed out. In chronic bronchitis, these tubes have lost their cilia, and this makes it hard to cough up mucus, which causes more coughing. More coughing makes the tubes more irritated, and this in turn creates more mucus. The tubes become swollen, making it hard to breathe, and smoking, even just a little, keeps the cilia from working normally. Therefore, mucus builds up in the lungs, and this can cause more damage. We also have under COPDs refractory non-reversible asthma. Refractory asthma is a type of asthma that does not respond to usual asthma medications. In an asthma attack, bronchial airways tighten up and swell. Medications can usually reverse this, opening up the airways and returning them to how they were before the asthma attack. In refractory asthma, medications cannot reverse the tightening and swelling of the airways. Now, with the terminology out of the way, let's talk about COPD symptoms next. Many think of shortness of breath and coughing as a normal part of aging, but this could be signs of COPD. COPD can progress for years without noticeable shortness of breath. And the symptoms of COPD can be different for each person, but the most common ones are increased shortness of breath, frequent coughing with and without mucus, increased breathlessness, wheezing, and tightness in the chest. There are different types of COPD, and each type may affect how well different treatments work and how your symptoms affect also your everyday life and how they progress. If you have another health condition in addition to COPD, also known as comorbidity, such as, for example, high blood pressure, heart disease, heartburn, depression, or diabetes, this can also affect your COPD and how you can manage it. Here are some things that can help determine your COPD. First, do you have a cough? If so, do you cough up mucus on most days for at least 3 months in a period of at least 2 years? If yes, you may have a chronic bronchitis type of COPD that will respond to different remedies. Then you can ask yourself, are your lungs stretched out and larger than normal? If so, this may be more of an emphysema type of COPD, and sometimes it is possible to decrease the size of the big stretched out places in your lungs. A sure way to diagnose COPD is spirometry. Spirometry is a test that measures how well your lungs work, and it's a simple and easy test that can help diagnose COPD. A person may have chronic obstructive pulmonary disease but not notice symptoms until it is in the moderate stage. It is important, therefore, to ask your doctor about taking the spirometry test if you are a current or former smoker, or if you have been exposed to harmful lung irritants for a long period of time, or you have a history of COPD in your family, such as alpha-1 antitrypsin deficiency related COPD. And don't worry about spirometry. It's a very simple non-invasive test. When you take the test, you will be asked to blow all the air out of your lungs into a mouthpiece that is connected to a machine that is known as a spirometer. And this machine will then calculate two numbers: the amount of air you blow out in the first second and the amount of air you blow out in 6 seconds or more. These numbers are represented as FEV1 and FVC, also sometimes called FEV6. FEV1 stands for forced expiratory volume in the first second. This is the amount of air you exhaled in the first second of blowing, and FVC stands for forced vital capacity, and that is the amount of air that you've exhaled in one entire breath. A spirometry test can also show your doctor how severe your COPD may or may not be. The extent of your COPD is classified into 4 different stages that are defined by your symptoms and the results of your spirometry test. The stages do not determine how long you can expect to live, or in many cases how drastically your symptoms are affecting your quality of life though. The stages are designed just to help your physician prescribe you the right treatment. In order to determine what stage you are in, your pulmonologist, based on your symptoms, may administer one or more pulmonary tests. People with a COPD have a FEV1-FEV6 ratio of less than 70%. The FEV1 percentage predicted indicates how severe the airways are obstructed, so blocked or narrowed, and less than 80% of predicted is considered moderate COPD, and less than 50% of predicted is seen as a severe COPD. People with asthma will have a low FEV to FEV6 ratio when they have an attack, and then it will return to normal or almost normal after using fast-acting medications. When it comes to the causes of COPD, we've learned already in our previous videos that a health condition rarely starts with the symptoms. Usually it starts way back with an emotional mental shock event or biological conflict, which is then the trigger for a whole cascade that acts on a specific organ or many organs, then also on the limbic system. It affects also your ANS, your autonomous nervous system, as well as the hormonal enzymatic level, and finally the organ. The biological conflict linked to the bronchi, usually also linked to the mucosa inflammation, is a male territorial fear conflict or a female scare-fright conflict. The male territorial fear conflict is the equivalent to the female nest worry conflict. In fact, the bronchi-related conflict is a territorial worry conflict, a fear regarding one's safety at home, where the pack lives, at work, in school, or even in daycare. The swelling in the bronchial tube can block the air passages, resulting in a bronchial atelectasis. On a lung X-ray, as you can see here on the right, the bronchus, void of air due to the obstruction, appears as a white spot. After a while, the bronchial tube reopens, accompanied by heavy coughs and sputum production. However, when the repair process is continually interrupted by biological conflict relapses, the scar buildup eventually hardens, with the result that the atelectasis remains. And this is also referred to as COPD, chronic obstructive pulmonary disease. The bronchial constriction causes permanent breathing difficulties even after the healing phase has been completed. During the conflict active phase, there is an ulceration in the bronchial mucosa that is proportional to the degree and duration of conflict activity. And the biological purpose of this cell loss is to widen the respiratory passageways so that more air can reach the lungs. The enhanced function of the lungs serves to facilitate a conflict resolution. There are no symptoms in this conflict active phase. During the healing phase, the tissue loss is replenished through cell proliferation, and healing symptoms can be pain due to the swelling caused by the edema, so the fluid accumulation, or tickles in the lungs, or itching, or pruritus. Those are characteristic for any healing involving squamous epithelial tissue, such as the skin. And of course, also coughing. And coughing facilitates bringing up the phlegm that contains the remnants of the repair process. A bronchitis occurs when healing is accompanied by an inflammation, typically also accompanied by fever, headaches, and this is because of the swelling in the corresponding brain relay, and also fatigue is very common since the autonomous nervous system is in a state of prolonged rest, so vagotonia. In conventional medicine, recurring bronchitis is generally associated also with allergies or bronchial asthma. Next, we need to discuss the lung microbiome. The Western understanding and treatment of chronic obstructive pulmonary disease is extremely poor to this day, unfortunately. Contemporary medical texts commonly say that only palliative treatment is available, but that the condition itself is not something that treatment can resolve completely. The main things utilized in the treatment are oxygen and bronchodilators. The latter, which over time makes the condition actually worse, primarily through its effects on the lung microbiome. Heart bypass surgery is also often suggested, though it generally does nothing except add more stress to an already compromised system. The rationale is that if the heart works better, the lungs will have access to more blood, which can then be oxygenated. A variety of medications are very common, also antidepressants and anti-anxiety medications among them. Benzodiazepines, one of the truly horrible drug groups, are not something actually that we would recommend to anyone. If you are interested in the reasons why, please Google the side effects and the addiction dynamics of benzodiazepines. Also important to know is that if you have COPD and you are on a complex of pharmaceuticals, as most people are nowadays, you should Google the side effects of each of those medications and compare them to the symptoms you have. In our experience, many symptoms that people have are coming actually from the drugs and not the diseases they are supposed to treat. As well, many prescribed drugs should not be taken with others that are also prescribed, but unfortunately physicians rarely take the time to look into this. Western medicine, oddly enough, has a very poor understanding of the lungs and their treatment to this day. Egregiously, until a decade ago, medical researchers in the West insisted that the lungs were a sterile environment, meaning that the lungs did not naturally contain bacteria. But even a cursory period of contemplation would have revealed the flaw in this thinking. Our mouths are filled with bacteria, and when we breathe in, tiny drops of saliva filled with bacteria reach also our lungs. The truth is that the lungs possess a microbiome very similar to our gastrointestinal tract and the skin, which makes, of course, perfect sense. The microbiome that covers the surface of our skin, the lining of our gastrointestinal tract, our mouth, our nasal passages, and lungs is actually the first line of defense of our immune system. In fact, it appears that these diverse microbiomes are connected as one unified system. So changes in the gastrointestinal tract microbiome causes alterations in the lung microbiome and vice versa. What is true is that the microbiome should be viewed as an organ system in its own right and treated accordingly. We think of helping the immune system, the adrenal system, the lymph system through the use of adaptogens or tonic herbs, but the microbiome system is perhaps even more important. And yes, while useful, probiotics are only a very first step, a beginning. We also need to address smoking, because we're gonna discuss a treatment protocol that does work, that alleviates damages to the lungs. It increases oxygen intake and lung function. It also increases healthy immune function. It elevates the energy. It reduces brain fog and depression and stops the progression of fibrosis in the lungs and the development of the tissue destruction seen in emphysema. The protocol is also very helpful for cystic fibrosis, asthma, and alpha-1 deficiency. And in contrast to the Western approach, the Chinese have been exploring the treatment of COPD in very sophisticated ways for millennia. Scores of journal articles report their studies on the treatment of COPD utilizing traditional Chinese herbs and herbal formulations. And those studies have shown a great deal of success in stabilizing or even healing the condition. Now let's talk about smoking. Tobacco smoking is generally in the West considered a primary cause of lung diseases. Actually, it isn't. Real-world problems are very rarely so simplistic, though it does feel good to have something evil to blame and attack, of course. The truth is that only about 25% of people who smoke develop also COPD. The underlying causes we already exposed in this video are more complex, though easy to understand. What is more accurate is that the inhalants of any type create a condition for COPD to occur. Smoking does affect lung function in two ways: heat and inhaled particles. The heat itself is inflammatory, because all inflammation is a hot condition, whereas the inhaled particles of the smoke affect lung tissue over time. And this, of course, does disturb the lung microbiome and normal cellular function. However, the same kinds of alterations also occur from many other situations and factors, such as air pollution, inhaling petrochemicals as we fill the gas tank in our cars, or cleaning chemicals that we inhale, perfumes, and body care products, most of which, along with cleaning chemicals, are of course petrochemically based, which also might explain why so many women, non-smokers, develop COPD. Also, of course, you can be negatively affected and develop COPD because you work in an industry with a lot of dust, such as home remodeling, carpentry, factory work, mining, of course, firefighting, etc., etc. So long-term exposure to any kind of inhalant alters the microbiome and cellular function of the lungs, which in turn creates the conditions for, but does not necessarily cause, COPD. And I'm becoming very tired of the moral posturing on this issue, because it shows little understanding of why people smoke. And we don't encourage smoking here, we just want to set the record straight. There are 4 primary alkaloids in tobacco, and nicotine is only one of them. Nicotine has actually some benefits. It is highly stimulatory for mental functioning, just as Ritalin actually, or amphetamines, or coffee. The other alkaloids in tobacco do other things. Most importantly, they are antidepressants, they relax, they are pain relieving, and this is a major reason why people do smoke. One interesting fact that is always overlooked is that smoking decreased the use of antidepressants and anti-anxiety medications, as well as pain relievers, rose in a one-to-one relationship. So there are always unintended side effects of seemingly well-intended simplistic solutions. And with that out of the way, let's discuss a COPD therapy that really works. In this graphic, you can see how this whole COPD develops and why we're gonna address it in the way in which we're gonna address it. So we have epigenetic factors, environmental factors, as well as stress, so toxic emotions that we've discussed that affect us. As well as, of course, the psycho-emotional shocking event that we discussed, and this will affect your limbic system, and it can be seen in brain edemas. This in turn will dysregulate your autonomic nervous system very quickly in about 3 to 4 months, and this in turn will affect your hormonal system. So you're going to develop an excess of stress hormones. You're going to also become depleted in adrenaline and become acidic. And therefore, you're going to have energy blockages, sleeplessness, tiredness, organ function impairments, but also cellular depolarization, fermentation, tissue acidity. You're going to notice the first symptoms. And then the microbiome, so the protozoa and the somatids and the spirochetes, your whole immune system slowly collapses, and you can even see, of course, cellular mutations. So what are we going to do about it? Well, to deal with the psycho-emotional side, we're going to use emotional release and to come to a resolution of the biological conflict. Then we're going to use melatonin and 5-HTP, niacin, NADH, vitamin C, and strophanthin 3 milligram, amongst others, to address the problems in your system, and also vivid artemisinin and herbaceous COPD that we're going to discuss in more detail. By the way, if you are interested in strophanthin 3 milligrams, vivid artemisinin, and herbaceous COPD, just give us a call, 1-888-773-3196. I'm also going to post, of course, the contact information in the description box below. And we're trying to stop the cytokine cascade. And we can also recommend that you also perform breathing exercises, for example, the Buteyko method. Also, galvanic therapy works great at the Aquatone Professional and photobiostimulation. I'm also going to leave links in the description box below to some amazing devices, galvanic therapy, the Aquatone, and some great photobiostimulation devices that we really recommend. And of course, we work also on our awareness and on our desire to live and to be healthy. Chronic bronchitis is, as we've discussed, an ongoing inflammatory process that slowly damages the cellular tissues and causes scarring, so fibrosis in the tissues. Western medicine has no idea yet why this chronic inflammation process initially occurs or continues to occur in the lungs. However, early research on the lung microbiome reveals that the condition is accompanied by significant alterations in the lung microbiome. COPD is an intermittent healing of the bronchitis due to a biological conflict which starts again and again. And we can conclude that the bronchitis-related conflict is a relapsing territorial worry conflict, which is a fear regarding your safety at home or where your pack is living, at work, in school, or daycare. And so without resolving this conflict, there will never be a complete healing of the bronchitis or a COPD. One more aspect that needs to be addressed is that there is a strong genetic factor also due to the TB bacteria, which was spread so much in the past 50 to 200 years. And this TB pathogen signature is many times imprinted in our cellular membranes and influences the development of respiratory diseases. And this kind of continuing long-term inflammatory situation in the body is nearly always caused by low levels of staph bacteria as well in your system. And this bacteria infects the cells and utilizes a complex series of cytokines to break down cellular tissue in order to feed. The early research on the lung microbiome has indeed found a group of infectious organisms in the lung tissue in small numbers that appear to be causing the continuous inflammation. And the protocol that we're going to outline below is designed to do several things. Nearly every herb suggested has been found to directly help COPD. So we're going to try to stop the chronic bronchitis, halt the progressive cellular degeneration of the lung tissue, normalize the cellular function in the lung tissue, reverse the fibrosis and promote healthy lung tissue regeneration, strengthen the immune system and its responses to outside stressors, increase energy, increase oxygen uptake, support the body's microbiome, normalize the body's cytokine cascades, stop the influence of the 4 main infectious organisms found in the lungs during COPD, and supply extremely healthy nutrients and support their uptake into the body, which of course increases overall health. Here is a list of the herbs that can help you with your COPD. In liquid form, you can use Chinese skullcap root, lonicera, cordyceps, Cidacuta, Codonopsis, licorice root, Bidens pilosa, Panax ginseng, Eleutherococcus senticosus, and ephedra. Dosage 1 teaspoon 4 to 6 times daily for 12 weeks or longer. Then also in liquid form to stop the cytokine cascade, you can use Lomasium, pleurisy root, Elecampane, Isatis, Hortunia, Osha, licorice, Yerba Santa, and Mirgam. And here again 1 teaspoon 4 to 6 times daily for 12 weeks. You can also support your COPD with herbal powder that consists of Chinese skullcap root, licorice root, Linocera, Eleutherococcus, Astragalus, Ashwagandha, Morus alba, Schisandra, Ledebariella, Atratolidis, Chlorella, Japanese knotweed root, nettle leaf, wheatgrass juice powder, Panax ginseng, spirulina, turmeric, and milk thistle seed. And dosage here for the powder is 1/4 of a cup of the powder, so about 0.8 ounces, taken in juice or dissolved in water, and you take it just before bed. And this means that you will use 24 ounces of the powder approximately per month. There is also a list of homeopathic remedies that are recommended. For example, antimonium tart. You can use this when there is an excessive rattling cough. Kali bichrome for bronchiectasis with coughing and thick tenacious expectoration. Pulsatilla for coughing and yellowish green expectoration. Silicea for offensive expectoration. Phosphorus for bloody expectoration. Arsenic album for cough and marked wheezing. Ammonium carb for shortness of breath. Kali carb for chest pain, and it attends also other symptoms. Hepar sulf for a purulent expectoration and when cold air exposure worsens the situation. Stanumet for copious green expectoration. Senegar for difficult expectoration. Stanumet for extreme weakness. Kali bichrome for ropey stringy mucus. Natrumur for white flag. Pulsatilla is also good for green expectoration or greenish expectoration. Silicea for yellow expectoration. Arsenic album, it's great for managing difficulties in breathing. And antimonium tart is also useful for persons who have excessive rattling of mucus in their chest and when they feel that the chest is congested and full of phlegm, but very little can be expectorated. Great for COPD is also to use nebulizers, and the formulation is pretty simple. The best thing you can get without a prescription to nebulize for COPD is glutathione. 1 single capsule dissolved in 5 milliliters of saline solution is what you take, and the best source for the glutathione is the Ternatural's reduced L-glutathione plus. Enhanced absorption, ultra purity grade, 100 capsules, which will last for over 3 months. Saline solution, module dose for inhalation can be bought on Amazon easily. And to this mixture you can add 1 drop of frankincense, eucalyptus, bitter orange essential oils or the like. And these essential oils have been found in Chinese studies to significantly help with COPD. You can also add 5 drops each of concentrated decoctions of Lonicera and Japanese knotweed root. And the Chinese have been using microparticles of these herbs in nebulizers, and they really help reduce COPD symptoms and they help the lungs heal. You should use those daily, and this will help with breathing, with the mucus overload, with the lungs healing and with the bacterial infection. So the nebulizer protocol looks like this. 5 milliliters moderate dose saline solution. You place it in the nebulizer cup plus 1 capsule reduced L-glutathione plus. Effervescent, so it dissolves easily in the solution in the cup, plus 1 drop each of the essential oils of frankincense, eucalyptus, bitter orange optionally, plus 5 drops each of a strong decoction of each of the following herbs, Lonicera and Japanese knotweed root. You can also use Mucinex, which is purified guaifencin from the guaiac tree. Guaifencin thins the mucus, and during early stages of COPD sometimes mucus is very thick and heavy, and this helps thin the mucus so it can be expectorated more easily. The thick mucus in the lungs is also a great medium, by the way, for bacterial and viral growth, so it is very important to reduce it and to expectorate it. And the dosage is 1 tablet 1 to 3 times daily. Great is also naringine. It's a very good anti-inflammatory drug for the lungs. Dosage here 4 capsules 1 to 3 times daily. You can also, and you should, supplement with vitamins such as A, E, D3 and K, B complex, niacin, B12, folic acid, vitamin B6 and N-acetylcysteine, as well as vitamin C. As far as minerals go, magnesium, zinc and selenium are your friends. Omega-3 is also great, so fish oil, also ubiquinol or CoQ10. Cordyceps also works great for COPD, either in liquid form or in capsules. And last but not least, your diet should be always rich in good organic proteins. And as always, don't self-diagnose yourself. We've showed you the test that you can perform at a professional and to detect first and foremost that you really suffer from COPD, and of course always consult with your trusted health practitioner before you start any treatment. If you need any advice, we are also here to help you. Just give us a call, 1-888-773-3196. We love to talk to you and figure out together what is best for you. If you have enjoyed this presentation, as always, please do support our work by liking, sharing and subscribing. Also hit the notifications button so you don't miss out on the weekly holistic health content that appears on this channel. And with all that being said, stay healthy until next time.